Good afternoon. I am pleased to join First Lady Jane Bashir and my fellow speakers to share with you the preliminary results of an extensive study on sexual assault and violence in Kentucky high schools. Results that show the efficacy of creative interventions designed to improve the long-term health and safety of Kentucky students. Over the last several months, I'm sure you've noticed that the national dialogue on sexual assault and violence, stalking and harassment on college campuses has grown more intense. The prevalence of these heinous acts have garnered now the attention of the national media, Congress, and the White House. It is not a new problem, and it is one that we acknowledge and began to address more than 10 years ago at the University of Kentucky, and one we have studied in partnership with the Commonwealth for the last 5 years. UK and Kentucky, I think again, are ahead of the curve. Our success as a university begins with one principle, and that is putting our people first. Nothing is more important in pursuit of that goal than ensuring the health, safety, and well-being of our students, faculty, and staff while they're on campus and wherever they are in the Commonwealth and beyond. When we began our work more than a decade ago, we knew that it would require more than a change in policy or organization. It would also, and most importantly, take a change in the culture of our campus. So how did we go about this? First, we had to honestly look at ourselves. We were among the first universities in the country in 2004 to do a campus safety climate survey, something recommended as a best practice today. We surveyed more than 1,000 female students about their perceptions of safety and the prevalence of sexual assault. So second, we analyzed these data, and we didn't like what we learned, but we knew we had to be open in addressing it. We conducted a news conference. We released all of our findings to raise awareness. Our third step, we knew we had to do something about it, and we had to design innovative ways to address this. So in a very entrepreneurial way, we developed interventions that we thought would empower individuals and spread that responsibility to everyone, the entire community. And the fourth step, which you really see today, is we always study our intervention, modify it so it can work even better, and then see if it can work in other populations to make a difference. So our breakthrough back then was under the leadership of former director Dr. Dorothy Edwards. She led UK's Violence Intervention and Prevention Center, our VIP Center, where we developed the Green Dot program, which has been pointed to as a model in national media outlets from the New York Times to National Public Radio. The program is a prevention strategy that focuses on the power of bystander intervention to make individual and social change. To date, on our campus, we've had some 5,000 student leaders who have participated in the training. In addition to the Green Dot program, the VIP Center has launched other initiatives, including training of our faculty on all of these matters. In the last year, 83 sessions alone were held for some 1,900 attendees. We found success because we moved collectively, bringing different talents, ideas, and resources toward a common goal. Today, we are proud to announce the preliminary results of another partnership directed at mitigating a range of hazards in Kentucky high schools. UK Center for Research on Violence Against Women and the Kentucky Association of Sexual Assault Programs, with funding from the Centers for Disease Control and Prevention, spent the last 5 years studying the impact of UK's Green Dot program in 26 high schools throughout Kentucky. In rigorous testing, the Green Dot program was shown by our researchers to significantly reduce the reported perpetration of violence, and that is a very good thing. As educators, we have an obligation to provide our students with a safe place to live and learn, and that is a journey without end. As a research university, we have an obligation to create, discover, and test novel approaches to combat the problems faced by our fellow citizens. The Green Dot program is just one of many designed to provide a safe environment for student success, birthed on a campus of investigators who are willing to ask hard questions and, more importantly, will work day and night to answer those questions. This is about building a culture of safety, of intervention, and shared responsibility for our fellow students and citizens. And I want to thank our talented researchers who have shown us how we best do this. Thank you. There is someone else to thank whose strong voice and action have been loud and clear when it comes to women and children. In her many roles as a businesswoman, educator, and community leader, Jane Bashir, First Lady of Kentucky, has dedicated her life to the service of others throughout the Commonwealth. As a former teacher, Mrs. Bashir is passionate about education. In 2008, she organized an initiative to address the state's troublesome high school dropout rates. Her program, called Graduate Kentucky, a Community Approach. And she has strongly advocated for legislation in 5 consecutive sessions to raise the compulsory graduation age in Kentucky to 18. And thanks to her efforts, in March 2013, the legislation passed. She is dedicated to addressing the rampant spread of breast cancer, which is the second leading cause of cancer deaths among women in Kentucky. And she launched the Governor's Garden effort to increase awareness about the benefits of locally grown produce and reducing our carbon footprint. Every year, Jane Bashir hosts the Shop and Share program, a one-day drive that collects donated goods from shoppers at Kentucky Kroger and Food City stores to benefit Kentucky Domestic Violence Association shelters. In the past 5 years, the drive has raised more than $2 million in goods and monetary donations. Ladies and gentlemen, please welcome a dedicated civic servant, an advocate, the First Lady of Kentucky, Mrs. Jane Bashir, who will share more information about this important announcement.
Thank you, Dr. Capilouto, and for all of those that are here today. He neglected to say that I'm also an alum of the University of Kentucky. So it makes me doubly proud. It makes me doubly proud to be a part of this announcement today, because this is a huge step forward all across this Commonwealth for our youth, for our adults, for our society. And changing the culture is what it's all about. Today's Green Dot press conference has that opportunity to make huge steps, huge change, and how we address each other in our society. You know, since my husband took office in 2007, I've worked, as Dr. Capilouto had said, I've worked with domestic violence, I've worked with substance abuse, and I've worked with children at risk. That comes, from partly being a former teacher, partly from being a parent, and now being a grandparent. All of these things that affect us, whether we have our own children or whether we are just a part of the community. The children of Kentucky, the young people of Kentucky, belong to all of us. Much of our efforts in this state have been directed toward adult behavior in so many of these areas. So I'm thrilled that today's announcement and what has proven successful on the University of Kentucky campus is being addressed in our schools and our high schools. Because with education, with resources, resources, and financial resources, we can actually start to intervene, and we can start to direct our youth toward a different culture. If we can change behavior early, whether it's in substance abuse, whether it's in their desire and what they want to do with the rest of their lives, if it has to do with their behavior toward each other, whether dating violence, bullying, or so many of the other issues that affect our young people, if we can change their behavior at an early stage, then we have a chance to change the entire culture of our adult population. You know, there was a conference that I attended recently that was on youth and mental health and behavior modification and substance abuse. We had a speaker there that day that has made a lasting impression on me. He's a scientist, PhD, and he talked about studies of the adolescent brain and the fact that the part of the brain, of the adolescent brain, that can determine social consequences, right and wrong, is not really totally developed until the age of 21 to 25. So when we're talking about all of the problems that our young people experience day in, day out, they need the tools that give them the ability to make the correct decision, because left on their own, they might not have those tools. In some cases, the parents can be part of that tool, but they need more than that. They need us. They need the adults. They need the university. They need the research to be able to help them formulate proper behavior toward each other and toward anyone in society. So what we're doing is we're making a game change for our youth, which quite frankly is a game changer for the state of Kentucky. During this time, and being First Lady, I've had the opportunity to meet with young people from all across the state. I wanted to find out what were their big issues that impeded their success, whether it was graduating from high school or making a life determination, so that we as a state could decide what we as policymakers could help these students with to improve themselves and therefore the Commonwealth of Kentucky. We discussed a lot of barriers to success, problems that they face every day of their life, either in school or out of school. Some of these conversations were very difficult. It had to do with drugs, alcohol, teen pregnancy, bullying, and dating violence. These were all barriers that prevented our children from being able to reach the success that they want to do. Now, a lot of these subjects have been taboo. We've not wanted to talk about them. We've not wanted to share the dirty laundry. A lot of our students did not want to admit that they had a problem or that they had experienced someone that was having a problem. This has been especially true for our teens and actually our tweens, our 7th, 8th, 9th graders. During these formative years, young men and women struggle with low self-esteem. They have a need to fit in with their peers, whatever that cost, or that's what they feel. And many are hesitant to seek help from adults. If their parents are not there, who do they go to? And that's what excites me about today's announcement. The lucky children have caring, watchful parents, and they recognize when their children are struggling, and they take steps to intervene. But many of our kids are not so lucky. Some are stuck in the vicious cycle of abuse, addiction, and violence because they learned that behavior from their own families. In the absence of an interested, involved adult, who do these children turn to for influence? And what's their guidance for the social mores and behaviors? Most of them look to the easily accessible and widely accepted mainstream pop culture. And what is that culture comprised of in today's world? The glorification of alcohol and drug consumption. Sex, violence, all we see newspapers day after day or on our newscasts. Several celebrities that are involved in this. They see it in their music, their TV shows, the video games, and the movies that are available for them. Just this week, our whole news media is covered with yet another role model for young men. The NFL running back, Ray Price. He was caught on tape hitting his future wife. Amazing that there is still that public debate in our opinion polls about what his punishment should be, about his guilt, and what was his wife or soon-to-be wife's role in this abuse. We should all be shocked. It begs the question, how are we to stop the cycle of violence and influence on our children? Answers: early intervention, education, access to treatment, and laws that protect our young people. These are our most effective tools. And we can develop programs such as this Green Dot program that will help our young people face so many of the problems, those barriers. So today, I am thrilled to stand with our top researchers and advocates to announce this tool for fighting the cycle of dating violence and school-based violence. Staff from the University of Kentucky Violence Intervention Program, the Center for Research on Violence Against Women, and the Kentucky Association of Sexual Assault Programs are all here today to announce the groundbreaking findings of a program to help prevent violence among our youth and to our youth. I believe the findings of this study will positively impact the way we, as a Commonwealth and as a nation, think about violence, prevent violence, and ultimately reduce the occurrence of violence. This is a game changer. And we in Kentucky can lead the way. Thank you all.
Good afternoon. My name is Rhonda Henry. I'm the director of the University of Kentucky's Violence Intervention and Prevention Center. I'm incredibly proud to be part of an institution that has supported violence prevention for many years, long before I was a staff member there. We continue to serve our campus using this model, the Green Dot, as our approach for primary prevention and how to engage people on campus in all their different roles. As our campus continues to grow and change, we continually are reevaluating what is the best way to deliver this message, what is the best way to engage people in this conversation. Over the past few years, bystander engagement has become a more common approach in many areas of UK, especially those that focus on wellness and healthy living, all aspects of that. We are continually looking for ways to collaborate around this, both with our campus partners, but also our community partners, to strengthen the efforts of all of us to build a better, stronger, healthier, safer Kentucky. With an ever-growing student population, we also look for ways to maximize our impact while staying true to those core principles of what makes Green Dot an effective primary prevention strategy. We believe in the power of an engaged bystander. We see the positive proof every day when students and staff and faculty come and tell us what their Green Dot was. They're excited to be part of the solution and not just standing back and not shaking their head wondering how they could be involved. We know that one person at a time, one action at a time, we can truly shape a violence-free campus and a violence-free community. I am proud to stand with these amazing collaborators and to be a part of this project. Thank you.
Hi. I'll own it. I'm an alum, too. My name is Eileen Recktenwald, and I'm the director of the Kentucky Association of Sexual Assault Programs, which is the coalition of the state's 13 regional rape crisis centers, many of whom the leaders are in this room today. it is my job to give you some context for the awesome news we are here to announce today. In 1995, it's a little history lesson, bear with me, with the first passage of the Violence Against Women Act, there was funding set aside for the very first time for awareness education. Up until then, all the funding that was provided by the federal government was for direct services, which was a great thing, but we couldn't actually go out and tell anybody about what we were doing. So all of that money came to the state, administered through our wonderful partners at the Kentucky Justice and Public Safety Cabinet. Then there was some new money called Rape Prevention Education Funds that came down from the Violence Against Women Act, or RPE. They were designed to create awareness and education about the scope of the problem and to let victims know that there were services available. For 10 years, Kentucky used those funds to do a very good thing. They developed interesting relationships with the schools, particularly the high schools. They went whenever and wherever they asked them to go and presented about sexual violence, focusing in particular where research had shown the highest risk for victimization existed in high schools. In 2005, with the third reauthorization of VAWA, the money changed hands. It went from the allowable uses of awareness to primary prevention. And the oversight of the funds moved from the Department of Justice to the Centers for Disease Control and Prevention. The lens changed from criminal justice to public health. So KSAP and the 13 rape crisis centers that comprise the board, together with their traditional partner, the Department for Community-Based Services, engaged with a new partner, the Department of Public Health, who taught us a new language. We did not know what primary prevention meant, a new way of thinking about sexual violence as a public health issue, telling us that we could prevent it before it happened. We said, really? We were not at all sure that this was possible. That's the biggest understatement I'm going to say today. But what we did know was that for all of the 40 years, we have been engaged in the anti-violence movement in Kentucky. And all of the investment and support given to us by the governor's office and the Kentucky State Legislature, which has been very significant. The number of men, women, and children victimized by perpetrators of sexual violence has actually steadily risen. That's the bad news. If there was even a chance that we could actually reduce the number of victims coming through our doors at the Rape Crisis Centers, we had to try. So from 2005 to 2008, using special grant funds from the CDC, again, who are our partners, we conducted the Empower Project, inviting many partners who were just as interested as we are in reducing sexual violence to the table, and we formed the state prevention team. Dr. Dorothy Edwards, now the director of Green Dot, etc., was at the table. We developed a 14-goal state prevention plan. Yes, we were very ambitious, to reduce the perpetration of sexual violence. One of those goals was to find a strategy that worked. It was at this point that the KSAP board made the unprecedented decision to test one strategy statewide. As far as we knew, this had never been done by any state. If we were going to try and make reduction of sexual violence a reality, we were going to have to use our very small amount of RPE funds for something that actually worked. Guided by our new partners at Public Health and recommended by the state prevention team, we went to Dr. Coker and we said, help We don't know what to do. Please, we want to test the Green Dot strategy because it's already shown promising results. At UK, we would like to adapt it for high school. Dr. Coker and her team, with the help of Dr. Edwards, applied for a research grant at the CDC, and we were one of 2 funded that year. We began our research trial together in 2009. Throughout this entire 10-year journey, I wanted to make sure you knew this was not a flash in the pan. It took us a while to get here. A journey of partnership, trust, and hope. We have shared one single goal: the reduction of sexual violence in Kentucky. We would truly, really like to work ourselves out of a job. Throughout, many, many, many thanks goes to Dr. Coker and her team, Dr. Patty Cook-Craig, Dr. Heather Bush, and Miss Emily Clear and her gang, to the 26 high schools who hung in there for 5 long years when the going got tough, and it did, to the Department for Community-Based Services, Commissioner Teresa James, David Gutierrez, they're all back in the room there, Natalie Kelly, Phyllis Millspaw, who have never wavered. Phyllis is here, there she is, in their support for this project or this goal. To the Department for Public Health, Dr. Connie White, and Dr. Ruth Ann Shepard, who actually introduced us to Dr. Coker, thank you, Dr. Shepard, and to Joy Hoskins and Benita Decker, who's over there, who acted as our public health translators because we did not know the language. To the Rape Crisis Center educators. Now, get this. They actually wore iPods around their necks and recorded every single word of the curriculum for 5 years. They did this to ensure that it was implemented correctly across the state, from Prestonsburg to Paducah. And I have to say here, thank you, God, for Ann Brandon. Ann, where are you? Thank you, Ann, because we had a lot of turnover in educators, of course. In research, you can't wait for somebody. You have to have somebody there all the time. So she went to high schools all over the Kentucky. So thank you. We wouldn't be able here without her. To the KSAP board for taking a giant leap of faith, and it was giant, and believing and hoping with every fiber of their being that sexual violence could actually be reduced. And of course to Dr. Edwards and all the researchers who came before her to provide the scientific basis for Green Dot. And thank you to Mrs. Brashear and Dr. Capilouto for your acknowledgement that preventing sexual assault is very important indeed. But most of all, for the students, some of them who you see in their Green Dot shirts here, who participated in the research trial. They took a lot of surveys. Do we have to take this again? Yeah. They are the future of a violence-free world. May they carry and share, and sharing is the important part, the active bystanding skills they have learned with them wherever they go, and maybe, just maybe, within their lifetime, sexual violence will only be in history books. That was one of our goals in our plan. And now for the research results. Dr. Follingstad.
My role is a simple one, and that is to introduce to you the primary investigator for the research evaluation aspect of this project. So it is really my pleasure to introduce to you today Dr. Ann Coker. She is a public health epidemiologist and an endowed chair in the Center for Research on Violence Against Women. You'll notice our lovely banner. It's fairly new. And as the director of this center, I am so proud of the fact that Dr. Coker embodies our goal of generating quality research with the aim of enhancing the lives of those whose lives have been touched by violence, but ultimately, as you've been hearing today, to prevent violence. Dr. Coker's passion for evaluating programs along these lines for their efficacy, and believe me, if you've got a program, she'll evaluate it, has been an inspiration for everybody who has worked with her. And it is a pleasure to introduce her, to have her tell you about the culmination of these efforts for this major project with the youth of Kentucky.
So I'm really delighted to be here. I feel like I have two missions. One to tell the story for the press corps right here, and also to say thank you to the people behind. If you're watching this online, it's a little bit toasty in this room, so I will be as brief as I can to share the good news to help everyone in the room in that way. All right, as it has been mentioned, in 2009, the University of Kentucky hosted a press conference to acknowledge the funding of $2 million from the Centers for Disease Control and Prevention to fund this research, and today we're providing you with the preliminary results. I think I'm going to leave off a discussion about what the green dot is, but if any press has any question, you've got a room full of people that will tell you exactly what a green dot is. But our job as the evaluation team was to determine the efficacy of the green dot program to reduce sexual violence and other forms of interpersonal violence that disproportionately affects young women and young men. The CDC funded this study, as was mentioned earlier, because we were proposed to use the most rigorous design, and we had the team, many of you are in this room, to implement that intervention. Trained Rape Crisis Center staff provided the program to half the high schools included in this trial, and we call those the intervention high schools. No green dot training occurred in the control high schools. To evaluate the efficacy of the Green Dot program, that is a bystander-based violence prevention program, our team surveyed all consenting students in 26 high schools across Kentucky. I mean across Kentucky, okay? We have one central question that I want to provide the answer to today, and that is the ultimate question, which is, does Green Dot work to reduce sexual violence? We measured sexual violence using the language that was developed by researchers at the Centers for Disease Control and Prevention. The definition included unwanted or coerced sex, being too drunk or drugged to consent to sex, and physically forced sex. As was mentioned, we looked at other forms of intimate partner violence, and of interpersonal violence, and those included intimate partner violence or dating violence, sexual harassment, stalking, and bullying. Okay. If Green Dot worked, we would expect to see then a reduction in violence over time as the program was implemented in the intervention schools, high schools, and little or no change in the control schools. We measured both violence victimization, that is what happened to the student, as well as perpetration, that is what the student did to another. To be considered an effective program by the Centers for Disease Control and Prevention, as well as our colleagues, Green Dot training needed to reduce both violence victimization and particularly perpetration. All right, I get to show you a slide. I actually can speak without PowerPoints, but not often. So I'm really happy that we have made a PowerPoint presentation possible. Okay, so in 2010, when we started collecting data, that is the beginning of the study, as you can see on this slide, the mean sexual violence frequency scores were very similar. Okay, the green solid line indicates the violence rates in the intervention schools over time. The red dashed lines indicate the same rates in the control schools, again over time. By the spring of 2012, when the Green Dot program was fully implemented, rates of sexual violence perpetration began to change, such that in 2013 and certainly by 2014, the mean rate of sexual violence was significantly lower in the intervention high schools compared to the controls. In fact, over that time period, sexual violence perpetration in the intervention schools declined by more than 50%. I'm going to say that again, 50%, 50. While rates slightly increased in the control schools. and these differences are highly statistically significant and suggest that the program reduces sexual violence perpetrations. So all of the PhDs would clap at that last component that was highly statistically significant. Okay. All right. We also measured the effect of the program to reduce other forms of violence, and this is a slide that presents same two trajectories. You can see them, a reduction in all forms of violence over time, and it's also statistically significant for both perpetration, which is presented here, as well as victimization. Now, with any intervention trial, it's important to say that the program works as it was implemented, okay? Green Dot staff received rigorous, as you've already heard, rigorous, and they can tell you, rigorous training in these high schools. The training was carefully evaluated by a team led by Dr. Cook-Craig. Input was also provided directly to the Rape Crisis Center staff who were trained by the developer, Dr. Edwards. Rape Crisis Center staff are ideally trained to deliver this program, not only because of the intensive training that I just mentioned, but because they already have the skills and the training to provide counseling and advocacy to those who experience sexual violence or dating violence. Now, why is this study important to Kentucky and to the nation? Well, this randomized intervention trial, which is the best study design that we can use, is the first statewide evaluation of a bystander intervention program that has ever been conducted. More than 100,000 students participated in this 5-year program. With these results, Kentucky leads the nation in providing both hope and evidence that this homegrown product, that is the Green Dot program, reduces violence. Green Dot may be one of very few programs that actually reduce sexual violence. Reducing sexual violence is important because interpersonal violence may cause both physical and psychological harm that have lifelong impact, not only for young women, but also for young men. So what are the next steps? I've already gotten this today. What are the next steps for the Green Dot in Kentucky? Well, through CDC funding, that is rape prevention education programs, to the state and then to KSEP, that funding will continue. And that will continue to be provided through KSEP to provide the same programs to the high schools that are already already part of the trial. Okay, the trial will end. However, the trial will continue to be evaluated, and Dr. Cook-Craig is actually on that evaluation team. So the program will continue to be available and will be evaluated. I want to say thanks to a number of people in this room, and I will do so briefly. Okay, it's been my great fortune to play a role in this team. And the team, many of you guys are here, and I would like to publicly say thank you. I want to specifically mention Dr. Heather Bush, who's at the University of Kentucky, serves as our biostatistician. Candace Brancato, who is our data manager and analyst and is probably picking up her cute little 3 children right now. Dr. Patty Cook-Craig, as I mentioned, is the fidelity and process evaluator. Emily Clear, who's going to raise her hand so we'll know. She is our collective brain for this project. She is the program manager and master logistician for this project. There have been several graduate students who have gotten up at 5, well, really probably 4 in the morning and come home very late to help us collect the data. And I wanted to say thank you as well to, from the University of Cincinnati, Bonnie Fisher. Dr. Bonnie Fisher, and online to our project scientific officer, Dr. Sarah Dejoux from the Center for Disease Control and Prevention. Without question, this project would not have been possible without the dedicated statewide team of Rape Crisis Center staff. And many of you are here, so give yourself a hand. All right. Okay. Most especially, I wish to thank the driving force behind this endeavor, Eileen Recktenwald. She envisioned a Kentucky without sexual violence and without dating violence. It's her hope, her vision, and her consistent nurturing that made this study and made this day possible. We are here to boldly celebrate the possibility of change. Preventing sexual violence, preventing interpersonal violence is possible, starting here and starting in Kentucky. So I am happy to take any question. Our team is happy to take any questions that anyone has at this point in time. So thank you very much.
You know, I was supposed to introduce each one of these people, but they didn't wait for me. I had wonderful things to say about them, but I think their action and deeds really speak for themselves. And as the newest Kentuckian, I think, on this podium, I'll tell you, this is the reason people move to Kentucky, because it's about your character, what questions you ask matter, and how you answer them. And I'll say one other thing, too. 3 weeks before she died, Maya Angelou, certainly who confronted these matters in her life, said that courage was the most important virtue, because without it, you can't consistently practice all the other virtues. So I want to thank these people who are my heroes, and I really want to thank those students out there for practicing these virtues as well. Thank you very much.